Community Health Partnership held a series of county meetings just a couple, 3 weeks ago. They, in their wisdom,
can I stop you for a minute? I didn't get permission for you to be video recorded.
It's fine.
You're fine? Are you fine?
Fine.
Okay. And can you tell us who you are, or are you a parent, or are you a provider?
I'm Mort Cypress. I'm a parent and guardian for my daughter.
Okay, thank you.
Community Health Partnership limited the sessions to 1 hour. And then they spoke most of that hour, which of course is designed to prevent much input, much interaction. They spent most of the time talking about transportation and how they were transferring the cost of transportation to the providers. They dropped in the midst of all this that they lean towards independent living for the member clients. And I thought a little bit what happened with Northern Center. My daughter is not involved with that, but moving people out of Northern Center often into their own apartments. There was no, when I spoke to one of them afterwards, they said that we underestimate what our children can do, and they can do a lot more in this independent living. That strikes me as, when you're dealing with developmentally disabled people, as a guarantee of inadequate service.
Well, I met with some guardians today at lunchtime, and one of the concerns that they brought up, and maybe it's similar to the one you're making here, is the notion that if you put a person in a setting in which they don't get adequate supports, there's a potential for two things to happen. One is abuse can take place, and the other is neglect can take place. And we want to make sure that we always are considering the fact that an individual with a developmental disability should have the opportunity to have a lot of life experiences. We call that the dignity of risk. It was put into place many years ago. In fact, a guy, I think in the 1960s, wrote an article about it. You can't assume that people are not going to be able to handle things, but assessments are designed to try to help you identify where there are risks that need to be managed. In other words, if a person doesn't have navigation skills in the community, you want to make sure that before you allow them to go out independently and walk across the street or catch a bus or whatever, that they know how to do those things, that they've got the training needed and the support needed to learn those things. Not to make sure that there are adequate supports in place for a person who has needs would be considered neglect, right? And if somebody is being abused or neglected, there's a reporting process that's supposed to take place. There are critical incident reports that are required. We want to make sure that all those systems that were designed to catch incidents like that are kept in place. And you've got to question whether or not some of the designs that they're talking about are going to maintain the safety of the individual through this process. So supported living can work, independent living can work, but it's based on an assessment, it's based on learning skills, it's based on trying things out. And you want to make sure that those supports are not pulled away too fast. And if they are, then you risk things like abuse and neglect taking place. Abuse because somebody is vulnerable and somebody can come in and do something that you wouldn't want done to your family member. Neglect, if in fact the person needs a service and they're not getting it, then that could be considered neglectful.
If I could just add on, I think that that's a great goal. And it should be all of our goal to figure out, are there people that we're underestimating? We should be able to do more than they can do. That's fabulous. And I think if all of the stuff we're reading and stuff we're hearing out of CHP about we want to do more independent living, we want to do more of this, if that was the 5-year plan, that'd be a pretty good plan. Because I bet if little by little we could identify people and we could maximize what they can do. What I'm hearing from people who are calling me is they're hearing from care managers, we've been told we got to move lots of people out of group homes into independent apartments to save money, so that's what we're going to do. That is not a plan. That is not a plan.
And that sets people up for what I just mentioned. People don't need to be set up to be harmed because of a financial problem that a managed care organization is having.